With dementia, their short-term memories start to fade away, but those long-term memories are intact. So what it does is it really helps bring those long-term memories forward.
Welcome back. You are watching the Dr. Nandi Show. I'm passionate about helping people live their best possible life. And today we've been talking about the importance of keeping your brain healthy. Now, it's best to start these lifestyle changes when you're young, but that doesn't certainly mean you can't benefit when you're older. My next guest is a nurse and the director of resident care at an assisted living and memory care licensed home called My Doctor's Inn. Please welcome Rebecca Holland. Rebecca,
Hi.
welcome.
Thank you so much for having me.
Of course, you have a Montessori program, right, that helps residents. Tell us about that, and especially in your memory care residents. How does that help?
Yeah, so at My Doctor's Inn, we did adapt the Montessori approach, which has been proven to reduce that anxiety in dementia and Alzheimer's residents. It really helps them engage one-on-one with the caregiver, and it does wonders, helping them reconnect with the world that they are sadly losing touch with.
And what is the Montessori program?
The Montessori program it uses all 5 senses. So it engages the resident, again, one-on-one with that caregiver. It really, we have different boxes, smell boxes, different textures and things. Again, with dementia, their short-term memories start to fade away, but those long-term memories are intact. So what it does is it really helps bring those long-term memories forward. Folding clothes, doing things that they used to love doing prior to having dementia and Alzheimer's really helps try to bring those long-term memories back and reconnect them with that world.
You know, I remember when my dad was in an assisted living, they played that Dean Martin song, "That's Amore," and every single resident went on the floor, when the moon hits the sky.
Right.
And I was like, what happened? Because the entire dining room emptied and they all went out.
And they loved it.
Yeah, because that's their long-term memory. So do you do things like that?
We do. We actually do our life enrichment tailors to that resident. If that resident for their whole life worked with cars, we try to tailor that activity to work with that resident. You worked on cars your whole life, so maybe we'll incorporate car magazines into your daily living or something. Cool. Just again, we want to enhance their quality of life. A lot of times when people think of assisted living memory care, they automatically assume that's where people go and then quality of life stops. At My Doctor's Inn, we really pride ourselves on that quality of living and making it enjoyable for them.
And what about food and nutrition? How important do you think that is for your residents?
Yeah, it's so important, especially for brain health and making sure that adequate nutrition is met. Right. We do have a professional dietitian that tailors our menu to a heart smart diet so that it's met, low salt, low cholesterol. We do everything sugar-free. And the residents just love it. Never processed, never frozen. It's farm fresh to table.
That's awesome.
And they really very much enjoy it. And a lot of times meals is when we're getting the most fluid in them and again, that intake in them, especially with dementia and Alzheimer's. So it really is a time, again, to sit around together and they had their meals, at home. So we do a community feel. It's really a home atmosphere.
And you guys are watching the show. You're hearing the message again and again. And Fred and Ron, I want you to hear this as well. No sugar. Remember that. You're hearing no sugar every single time, right? No added sugars, and using fruits and vegetables and having this spirituality and purpose and thought. It helps you prevent. And also, if you already have memory issues, if you have Alzheimer's, it helps with those too. Thank you so much for sharing this. It's going to help a lot of people understand that all memory care centers are not alike, and you can really make it a great experience for some of your residents.
Yeah, we do. Quality of living is something, even as a nurse myself, is just something that I'm very, very passionate about. So for them to have quality of life with Alzheimer's and dementia, a lot of times people, oh, well, they don't know what's going on. They still do. They're still there with us.
That's awesome.
So.
Thank you so much. Hi, everyone. I'm Dr. Partha Nandi. And if you enjoyed that video, you're going to love the next one. It's full of incredible information to help you start your health hero journey.